Welcome back. Today we are talking about suture removal when we're working with interrupted sutures, and then how to apply Steristrips afterwards. We'll talk about wound assessment and equipment you need, all right after this. Welcome back. My name is Tammy and this is Nurse Minder, and on this channel we do everything nursing. So if you're new here, consider subscribing below so that you get the next video when it's released. Suture removal is a fairly common skill you may be doing if you work in a med-surg unit, especially a surgery unit. And it's not a complicated skill, but there are some very critical elements to remember to make sure we're putting our patients at the least risk for harm. Some patients will ask if suture removal is painful, and most often it's not, but there can be some tugging and some discomfort, and depending on how long those sutures have had to stay in, there may be some scar tissue built up, and definitely you're likely to see some drainage on the exterior surface of the skin that may be making it a little bit more challenging to get that suture out. So if your patient is expressing concern about pain, you may want to look at maybe providing some non-pharmacological methods of pain relief, perhaps offering them a warm blanket. If they do request an analgesic, then I would certainly support that for them and make sure I administer it in time for it to take effect before we remove those sutures. Let's go over some of the supplies you may need to remove your sutures. We do have to clean our hands, so our hand sanitizer or soap and water is required, along with a clean set of gloves. This is not a sterile procedure. The next thing I want to gather is my suture removal kit. You'll see that it comes with scissors, tweezers, and a gauze. Now the gauze can be used to gather your sutures onto. I see a lot of nurses use it that way. Or you can keep that sterile and use it to cover the wound after you've removed those sutures in case there's drainage. You can see my kit's been opened a few times. We would keep that wrapped up until we need it. The second thing I'm going to grab are some Steristrips so that I can put those onto the wound after I have removed the sutures and cleansed it. And this will help add some tensile strength to it as it continues to heal. Those Steristrips will stick better if I use a skin protectant pad, so I've got one of those. And then I have a couple of different cleaning aseptic tools, so I've got my Soluprep pad or my alcohol swab in case I need to clean that wound, the wound edges, not the wound itself, prior to. And in case there's extra dried secretions, I may just find myself requiring some saline and some gauze. So you would determine what you need prior to going in. Now we're at the bedside. If there's a dressing, you want to remove it and inspect it for any drainage. This appears to be dry and intact. The second thing we're going to look at is the wound itself before we remove any sutures. We're still responsible to make sure that that order fits our patient's current situation. Now, as we're inspecting the wound bed itself, we need to be looking for that nice pink healed tissue. We're looking at the wound edges, and that just means that the two sides of the initial insult, whether that was a cut or a tear, have come together, and we call that well approximated when those two edges join up nicely. And so what it looks like here is I do have that pink healthy tissue all the way down the middle of the scar. This means that we have some tensile strength. Next, I want to count how many sutures I have. So I see 1, 2, 3, 4, 5. So these stitches have been in for a long time, and all of that exterior exposed stitch is considered contaminated. So I'm going to clean it up with my Soluprep pad here. And that's to help prevent the spread of any microorganisms and contamination as I remove those stitches accidentally going into the patient's body under the skin. So after it's clean, I'm just going to get my supplies ready. I'm going to open up my suture removal kit and set it aside here so I've got a little bit of a sterile field. You notice that there's the gauze, the tweezers, and the scissors inside. Get my Soluprep pad and my Steristrips ready to go. We're going to start by working with our tweezers and our scissors in order to remove our first suture. So you'll notice that these scissors in particular, they've got a little bit of an edge or a little bit of a curved end, and that is to put underneath the suture so that we can grasp that suture and cut it at skin level. So by grabbing onto the knot, and I need to turn my scissors around here to grab that inside, You can see I'm going to cut closest to the skin on this side and my suture that I'm going to pull through, there's no contaminated area. So now I can just simply pull up, and I have my entire suture, and I'm going to just put that over into my plastic. So I started with number 1, so I'm going to go now to number 3. Again, grab that suture underneath, clip, stabilizing it. I'm just going to pull straight up. Now I've brought the gauze into this particular part of the video because some people will use the gauze in their sterile package to put their sutures on. And so just again, I'm going to grab that knot. I've got my scissors open. You can see I'm going under and cutting right close to the skin. Stabilize and lift up. And I can set that over here. Now that I've removed every second one, I'm going to re-inspect that tension. I see that the wound bed has not pulled apart, so it looks like it's safe to continue on. So we're just going to remove the others. Now after removal, I want to make sure I have all of my sutures, so I'm going to come and just take a quick check. 1, 2, 3, 4, 5. I do have 5 sutures, and I have a healthy wound bed. So now I'm going to clean it up and put on my Steristrips. Cleaning this wound can involve simple gauze and saline if we need to get off gunk. Or I can use another alcohol prep pad, cleaning up both of those sides. So I'm just going to go ahead now and grab my Steristrips while that's drying. And you see that this comes with a perforation. We're just going to pull that perforation off. And these are now ready to simply lay down and spread across my wound. Now before I do that, I also want to use my skin protectant pad. Just open this up. And now I can, all the way around my wound, I don't need to cover my wound, but the skin around it. Now the skin protectant does get a little tacky. You can see that my gloves are starting to stick to each other. That's going to help the Steristrips stay on the skin longer. So now I'm simply going to I want to make sure that I have about a ½ inch on either side of my wound. I've got that labeled out. I'm going to put down my 3, flip it over, and as I pull out, I'm just going to lay those down. And I see one came off, so I can certainly grab that by my gloves. This is a clean technique, and put that across my wound. When it comes to teaching your patients about Steristrips, we certainly want to keep those on for as long as they will stay. They can wash and shower, but you don't want them to emerge in water. And then these will just fall off on their own over time. You're prepared to care for your patient's suture removal should the time arise. And if you've watched a lot of my videos, you know what's coming next. Until next time, make it a great day.